Hospitalizations from the coronavirus are up here in Wisconsin as new subvariants are on the rise in South Africa. Joining us now to talk about it all is Dr. Jeff Potoff, UW Health's Chief Quality Officer. Let's start with those hospitalizations here in Wisconsin. We are seeing the numbers tick up just a little bit. What's driving this?
Yeah, what's driving this is that BA.2 subvariant of Omicron. We are seeing increased cases, and we know that the cases that we are recording are an underrepresentation of all those cases. Hospitalizations up a little bit. I'm hopeful that they only go up a small amount. We're hopeful that previous immunity from previous Omicron infection and people who are vaccinated and boosted results in mild illness for folks catching this BA.2 variant and less hospitalization. So a little increase right now. We don't want to see that to continue to increase.
And of these hospitalizations, are you typically seeing patients who are not vaccinated, who have never had natural immunity by getting COVID just naturally, or are these people who are immunocompromised dealing with something like that?
Yeah, it depends on the location. Someplace like Dane County, where a high proportion of folks are vaccinated, we do see people who are vaccinated, not as often boosted. But the other thing that we see is about 50% of those people are coming in with COVID symptoms. They're suffering from COVID. The other 50% don't have symptoms or have mild symptoms, are in the hospital for something else. So lots to pick apart on that hospitalization number.
So once somebody does contract COVID and they get the test back that's positive, there's a lot of antiviral pills right now, and they are available here in Wisconsin. Is that something that patients should be starting right away, no matter how mild or severe their case is?
Yeah, I think this is something that's not as well known as it should be. So we have antiviral medications that are well tolerated. They decrease your chance of needing to go to the hospital by 88%. Like you mentioned, there's a timeline. So you have to have a positive test and you have to start treatment within 5 days. So you can't wait on this one. You should have some features that would make you high risk, either underlying medical conditions, maybe your age. And the thing to note, to be aware of with your provider, your doctor, is that these medications do have drug-drug interactions. So you want your doctor or a pharmacist to look at your current medications and make sure it's compatible with these antivirals.
Is this similar to a Tamiflu when people come down with influenza?
I think you could look at it that way. There's a timeline on when you have to get it. The benefit for these antivirals is probably even better than Tamiflu, which just reduces symptoms for 2 days. But you have to be on top of it or you'll be outside that window.
Really quickly, before we let you go here, let's talk a little bit about those subvariants that are now surging in South Africa.
Yeah, so what we're seeing now is Omicron is the dominant variant, and now we're seeing the evolution of Omicron with different subvariants. BA.4 is now in South Africa. It's even more contagious, which is a common theme that we see with these subvariants. And the other thing that it looks like it does is it defeats natural immunity against Omicron a little bit better than the previous variant. So if you came down with Omicron before thinking you have good protection, BA.4 starts to beat that a little bit. So we'll have to see what happens here. But right now we are keeping an eye on that BA.4 variant.
Got to stay on our toes, always. We appreciate you, as always, as well. Dr. Potoff, thank you.
Thank you.